Good morning. It is 9 o'clock, so we are going to go ahead and get started with our budget hearings. Thank you all for joining us this morning. I know we have quite a bit to get through in our first session of the morning, so I'll turn it over to Sarah.
Thanks, commissioners. In this first session, we are hearing from human service providers that were rated either high or medium with their supplemental requests. I just want to, and then hopefully we can squeeze in the county clerk around 10. So we have about an hour for this. And then we have conversation with our behavioral health partners after that. So for those of you that have been here in the past, these are going to work a little differently than they have in the past. Jill is going to provide an overview of base funding and supplemental requests for human service partner agencies. And then we have folks here available if there are questions concerning that, but we're not planning on formal presentations for today. We've just got an opportunity to sort of respond to questions from commissioners on supplemental requests and base funding. I feel like because we've got a lot of people here who weren't necessarily a part of the sessions earlier, just want to state that, this was an extremely difficult budget year for the county. It's 2.7% assessed valuation growth, which is the lowest I've seen in 11 years here. And normally we're about 5%. So it's roughly half of what our normal tax rate is. And so it made it extremely challenging when presented with more supplemental requests than we have in the past into how we moved into this budget process. So with that, I guess I just, to add more of a gray pallor on an already gray day, I will turn it over to Jill to walk the commission through the community partners.
Good morning, commissioners. I'm going to do a share screen here in a minute. I should probably turn my video on. Let's see. Okay. Make sure I'm right. Okay. That. So similar to one of the presentations I did yesterday, I'm going to just kind of walk through at a high level. Our human service providers there, we've got several of them that are within our agencies that receive that ongoing general fund support through our community partners budget, which is on pages 4 and 5 of your big budget report. There's a variety of organizations that are serving our at-risk populations in the community. Food, feeding supports, rent and utility assistance, emergency sheltering, and a whole lot more than that, as we've learned this last year and a half in the COVID-19 pandemic. So I want to highlight those that we're going to talk about today, just to give an update on those different organizations and what their base level is, what their supplemental requests are. And then we'll open it up for questions probably first on the supplementals before we talk about some of the overarching human service in the future for Douglas County. But I want to make sure that we have some time to allow you to ask questions about the requests that have been submitted and the supplementals if you have any. First one is for Douglas County Casa. You see here what our existing commitment has been. You see their supplemental request that they've submitted this year, and that's ongoing funding for partial support for a full-time volunteer advocate coordinator. This was rated low. You see for just food, our base level of support is $25,000. They've submitted a supplemental request for ongoing fund of $25,000 for ongoing funding for operations that was rated medium. Lawrence Community Shelter, our base funding is $296,000. They submitted a supplemental request of $86,800 ongoing funding to support additional operating expenses that have been associated with the additional capacity and the rehabilitations that have been made to that facility in the last year in response to a good amount of COVID-19 funding to make some much needed capital improvements there. You can see that that is rated medium. The children's shelter, you see our base level of 275, 495, and then a supplemental request, which was $20,000 in ongoing funding support for families to support the families of the children that they're working with basic needs, food, rent, utility assistance. This request is in response to or related to the loss of previously awarded funding from the city of Lawrence. And that was rated medium. You see a request next for the STA Care Center of $5,000 base level and a supplemental request of $45,000 in ongoing funding for full-time prevention specialists that can support and coordinate community-wide intersectional upstream approaches to sexual violence and other forms of violence, including but not limited to the efforts of the community health plan. And that is rated high. Our next request is Trinity in Home Care. They have a base level of $60,000. Just for a little history, that was $30,000 up until, I believe, late last year when we increased it after some time that was spent on really understanding the challenges that they're going through. And they gave us a good appreciation for the supplemental request, which is an additional $30,000 in ongoing funding to offset losses due to low Medicaid reimbursement rate, and just to provide a higher level of support for direct care wages. It's rated high. The Ballard Center, they have historically received a base level of amount of $18,870. That's specific to the Emergency Services Council funding that they've received. And we can talk about the Emergency Services Council more later in the conversation. And we talked about Emergency Service Council earlier this year with you all, kind of to pave the way for this conversation. But they've got that base level of support for rent and utility assistance that they've been doing for a very long time. And then they submitted a supplemental request of $41,250 for some ongoing funding to staff and program support for a family stabilization program, just to respond to the increased need and to support, the funding that those ESC dollars go towards. That's rated medium. Next request is related to Willow Domestic Violence Shelter, and same thing with them, that we have given them base level support through the Emergency Services Council in the past of $4,355. They have come to us this year with a supplemental request of $50,000 ongoing funding to support operational support and assist them in having a greater ability to leverage some additional federal grant program funding. And that is rated high. And because I highlighted the other ESC agencies, I did want to make sure that I mentioned, I listed here Senior Resource Center. You see their base level of support, and then you see the Emergency Service Council funding that they receive in addition to that. And then I'll just mention the last two that have historically received funding through the Emergency Services Council, and I have that listed down here, are Salvation Army and ECAN. And you can see their amounts there, at least for this year and last year. We have two new agencies that have requested first-time funding from the county. The Housing Stabilization Collaborative request, which is coming through Tenants to Homers, which will serve as the fiscal agent for that program. And I want to mention that it's a strong partnership with Family Promise. They've requested $404,000 in ongoing funding to support housing and resource navigation programming, and that direct assistance that is estimated to serve 160 households with an average payment of $1,875. It's rated high. The last request that we wanted to highlight is tenants to homeowners has a separate request of $50,000 in ongoing funding to support supportive housing service programs and offset some losses of funding from the United Way partner grants in the past. And that is rated high as well. So I'm going to pause there. Any questions on those supplementals?
Thank you for the overview, Jill. And I think that this question may be slightly unfair because we had to bump our discussion of administrative budget to tomorrow. And I think that that would have really helped frame some of this discussion a bit more, but I'm going to ask it anyway. We have quite a few asks from community partner organizations, and I'm wondering how we think about kind of overall coordination of this work and priorities for the county and how that's fit into the ratings that are suggested by staff.
I can answer a little bit of that. This is the first year that we've rated requests, and really we did that to try to assist the commission as we go through this process. But like a lot of things staff does, we might be wrong. And in some places, it's a ability to give staff for the commission to have a reaction to what staff has put forward. It's challenging. You heard yesterday from a lot of requests that were rated low. And it's, I believe everyone in this room, and I believe everyone who submits requests to the county does great work. So it's a difficult process. What I would say in terms of trying to make some distinctions between high and medium, the county traditionally funds human service providers in 3 areas. We have a strong role in health and behavioral health. And you're going to hear from some more of those folks later today. And then we talk about at-risk populations, which is everything from at-risk youth to seniors to folks with developmental disabilities, and a wide spectrum between, in that large array of folks that are in that area of at-risk services, and then vital safety net services. The county commission has talked for a period of time that, we need probably, I think the community would benefit from a stronger sense of mission around those 3 priorities and what the holes and gaps are in our community and what is the role of the county commission in filling them and what is not the role of the county commission in filling them. So, as I put this budget forward, I don't anticipate to have all the answers. I don't anticipate that this budget solves everything, but hopefully to create conversation and opportunities for us to discuss about what those priorities are. I think it's not a secret that I am as an administrator, I think it's part of my responsibility to make sure that if we have funding that is going for work, that it's accountable and that we have clear performance measures and outcomes for what it is that we're trying to achieve. At the same time, I know nonprofits really need flexible funding that allows them to do with it what they need to meet those needs. The balance between those two is a real struggle to try to figure out just what should be considered base funding. And then where is specifically the county commission trying to fund specific objectives that it's trying to advance? And I don't have the answer on that. I think that's something we'll all work collaboratively to come up with as we continue to kind of refine what the county's role is in providing these services. Does that help a little bit in terms of rating and what our thought process was coming into this?
That definitely helps. I think that, not to preempt what I'm sure Commissioner Kelly might ask, or I imagine Commissioner Kelly might ask, we know that we still have another round of American Rescue Plan dollars coming in. Quite a few of the discussions that Jill presented focused on some of that emergency aid that came through the CARES Act. We can't look into our crystal ball yet to see exactly what all of that's going to go towards. So how are you balancing out suggestions for this budget versus thinking about ARPA funds down the road?
Well, I would say that I think many of these projects are very well suited for American Rescue Act funds. And I think that part of that might have influenced, I don't think that influenced what made the proposed budget more than 2.7% assessed valuation. That was the overriding factor between what made the proposed budget. However, I think the ARPA funds do present a tremendous opportunity to provide assistance in this realm. As we've stated, our intent is that once we wrap up the budget process, that we're going to immediately work with the commission on how to structure that ARPA process moving forward. We have some real advantages to what happened with the CARES Act. We have longer to spend it, so we can be more deliberate into how we do that. I will always caution this group and this group of nonprofits here that we have to be cautious that if this goes to pay for base funding services to keep lights on in organizations, these funds will run out in 2024. And I do not believe the county will be able to take up the mantle of $23 million in spending moving forward. So I think we need to be cautious as to how we approach those funding. What specific things are we trying to accomplish and achieve within the next couple of years that we may likely not continue to do once those funds run out. So I think that process is yet to be determined, but this is a great preview for that conversation in terms of the needs in our community and, what combination of funding can we use to address those moving forward.
So Sarah, I want to take another shot at Commissioner Portillo's, the first part of her question. So if you look at, and we didn't get to do administration on the first day, there's a $142,000 request for Douglas County Human Service Navigation and Assistance Program. Yeah. If I took a lot of the things that you recommended in high, right, I could move all those over and we could swap those out.
Really could.
But I think, and it's especially good since our human services providers are here. We've been talking about better coordination for human services for a number of years. Can you give some ideas of how you think that position will help us be more effective in the human services area? I know we need some duplication of services because it is a net, right? But how do you see that coordination? If I'm a human service provider, I'm thinking, well, just give me my money, give me my supplemental request and don't organize it. Can you make maybe a little bit of a case for this is why we think we need organization and how that may be more effective? Yeah.
And I was hoping we could have a specific conversation around rent and utility assistance as a generic term. So, I'll give a little bit of a preview, but then maybe a little bit later we can kind of delve into that with some of the folks that are here. Rent and utility assistance has been an area of concern for Douglas County for 5-6 years. How long have we been meeting as the Emergency Services Council on this work? I think what the CARES Act showed us is when you infuse, and the conversations with that group have always been that there is insufficient funding and that is a generous term. It's pitiful funding for rent and utility assistance in this community that is really homeless prevention dollars. And I think what we saw through the CARES Act is when you make investments in that space, frankly, you can save lives. And I'm really looking forward to opportunities through the ARPA funds to continue that work. But we also learned in that process, and I always look at Dana sometimes when I get these numbers right, because she knows them better than I do. I believe 75 to 80% of the people who accessed funds through the CARES Act didn't need to move through a human service agency to do so, to receive those funds. Some do, and some don't. So how do we build a program that does that? How do we build a program that actively seeks other contributors like utilities and cities that also have costs in that realm? So I think there's a lot of things that we've talked about needs in that area, as opposed to, and I think our human service providers have told us more needs to be done in this space. And it's not the particular, I haven't heard from a nonprofit yet who's told me this is our mission. Please let us do all of it. I think we're incredibly grateful that Tenants to Homeowners and Family Promise stepped forward to put forward the Housing Stabilization Collaborative. When crafting the position that is included in the proposed budget, we met with that team and talked about, what if the county added this person to help coordinate, administer, develop the programs in coordination, in conjunction with our partners. So we have felt at a staff level that rent and utility assistance, housing stabilization, homelessness prevention, whatever you want to call it, and resource navigation are two particular areas where the county can be particularly helpful. We will always work collaboratively with our community partners in this work. We cannot do it without them. And we really value their expertise and leadership in this space. So I think that's what led to us putting that request forward. I thought your question might be, why don't we pay for that position with ARPA funds? And we certainly, I'm anticipating what might be coming next. And we certainly could do so. We just need to be prepared for, in a couple years, how do we add that position in? Because I don't believe that position will the need for it will go away. And we can talk more about housing stabilization later if you guys have specific questions on something else.
I was just curious about the ESC funds while we're on the topic a little bit. Do we have any sense of how those are distributed throughout the county? You know, the most intense need is, and the densest needs are in Lawrence, certainly. I know for a fact the City of Lawrence Utility Department is who a lot of those funds go to. But just curious if we have a sense of, are those dollars spread out elsewhere in the county? Are we seeing them go to Eudora or Baldwin utilities and landlords also? Jill, do you have a sense of that? I mean, or maybe we're not really tracking that because it's a disbursement of funds and that's not really a part of the reporting.
We've talked about it before. I think there's, historically, a lot of that data has been tracked in really bad databases like MacLink. But we've talked about that in the Emergency Service Council work group this last year, frankly, because we knew, similar with the conversation we had with Fire and Medical yesterday, we have to document the need and where the resources are most being utilized and what vendors, so to speak. You're absolutely right that the City of Lawrence is one of their utilities are some of the biggest users or benefactors. We don't have that right now though, but I do think the benefit of having a more centralized approach, I think that's the kind of information that the Housing Stabilization Collaborative absolutely have. So Dana and Rebecca are here, they can speak to that. They are tracking that information. And that's where I think the model, and we've had this conversation in the Emergency Services Council, we've been a slow evolution. While I was working on firefighter union negotiations for our monthly meeting this past week, Megan Poindexter graciously facilitated a conversation about how does this group evolve into the Housing Stabilization Collaborative, perhaps. We're all kind of sitting at the same table, but then how do we incorporate utilities? How do we still provide our agencies that have relied on this funding for a long time with that assurance that they are going to continue to be able to serve their specialty populations, seniors, those fleeing domestic violence, families, and maybe some that we're missing right now, honestly. But I think that I think everyone understands also from a workload perspective that what I heard from folks this last year was like, wow, thank you, Housing Stabilization Collaborative. You're like, thanks for taking some of this off of our plates. And there's just a great spirit of collaboration and cooperation. But also everyone's really resources are so scarce and there's so many families to serve that it's a delicate balance of how much do you funnel into a centralized approach, but then also not undermine some of the budgets of organizations that are already just barely getting by and not serving enough people and families.
I think it's really important to note that pre-COVID Emergency Service Council funding is just completely insufficient. The funds are gone the first day. So it's a little hard to track data when it's the first day and the funds are gone. I do think that would be a key component of this position. How would we track that? What data would we need? We've talked about it. There's going to be just a lot of flat out accounting and just, program coordination involved in that position and to how we could, try to create a program that we can sustain.
Yeah, and we see the work of Housing Stabilization Collaborative supporting all the agencies in some way, shape, or form. The work that they've done around developing landlord partnerships and agreements, just advocacy, but also just bringing all the stakeholders to the table on a monthly basis. I think that there's been 3 monthly meetings so far, and folks know Gabby, and she's the person that kind of on the day-to-day basis is the go-to there. But we're already seeing like a lot of coalescing of interests, but the need was absolutely there before COVID. We were talking about these same things before COVID. We were talking about how the county can play a larger role in coordinating human services before COVID.
I really appreciate all that. I think that we also keep using the word collaboration a lot. And I was really struck by, I believe it was in the care center's request, the discussion around kind of need for support to continue in all of the collaboration, because collaboration takes time and effort, and coordination is something that we kind of hold up as this big value, which it is, but it also is a drain on resources because of that time that it takes. And thinking about I want us to really think through how we can lower the administrative burden for agencies, but most importantly for the residents of Douglas County. And I know we have zero control over the Lawrence utility, but we saw some of the big administrative burdens for access there. And I want to make sure that as we're thinking through our work in human services, that we're trying to lower the administrative burden as much as possible.
Or if we can't, that we compensate for it. You know, if there are priorities for things that we feel are important work for people to participate in, coordinated entry for homeless services is another process we could talk about. How do we at least compensate or, accommodate for that? If there are priorities that the county commission feels are important for a community partner to be engaged in, we should provide funding to support that. Absolutely. And I think that's a little bit about, how do we braid all these important values together as we build a vision for what it is that we want to see moving forward. Yeah, absolutely. And then I think the resource navigation piece in terms of, and I love that term, and I think it means a lot of things to a lot of people. I think we need to do a lot more work on as a community as to what that really means and how do you just be there for somebody at the right time with the right information. And I don't think we're there yet. But I think that gets to your point about how do we make this easier for folks in crisis or folks in need to access the kinds of services that we have in this community. And that I think will take longer, frankly, to all come together. But some of that heavy lifting of how do we build that program, ARPA funds could help with. That's what these funds are fundamentally game-changing funds for how we approach human services in this community. No questions asked. I want us to be thoughtful and strategic as to how we use them to build a better system.
I was taken by the number of requests that were for operational support. And I think probably it's just a guess, but I'm guessing that every nonprofit that we work with, every partner could make a request for more operational support. Do you see this new position? I mean, one of the things we've really seen with, I think I just saw Bob walk in, Bob's position with behavioral health is that coordination. And even this year, a presentation to the commission of these are the behavioral health where they think that money should be applied as a collaborative, as a group. Do you see this position being that, or is it not there yet? It may get there.
I see this position as more boots on the ground.
Okay.
I mean, I see this position as helping to develop the program, the structure, taking the work that the Housing Stabilization Collaborative already is done, figuring out what we can sustain in that place, developing the data, the metrics, the, check distribution system. How do we put those kinds of things in place? That is work that right now, no one is able to really get off the ground with the exception of what tenants to homeowners and family promise have been able to do with CARES Act funding. so no, I think in terms of that longer vision, though, I absolutely see where the commission's talking about in that regard. I think Jill has done tremendous work in this space through the Human Service Coalition, and what's your ESF number in Unified Command? I always forget. ESF 6 for Unified Command for our, and there's a number of those partners here today, to help keep that work moving during the pandemic. But you're right. We asked these folks to go to a lot of meetings, and meetings take time. And you guys know from what I have said in the past, even if we pretend money's an infinite object, time is not. And so, if we're going to ask folks to be involved and engaged, I think we need to be, we need to make sure that they have the funds to support that work. And I think it's really getting to know a little deeper some of those connections. I was struck by a number of, hearings that I had in this area about folks that have really already maximized their federal funding sources. And until they're able to provide more local funds to provide match dollars for those, they're really unable to bring more federal dollars down. The commission knows that's something that's a huge priority to me. If we can leverage additional dollars coming from the state or the federal government locally, I think that should be a priority to us, because our investment doubles or triples in some cases. So I do think we need to look at that area as well, in addition to just how do we provide funding to make that kind of base level of support happen. And I think we also have to acknowledge that, part of the conversation I've had on this is I'm very cautious about this work, because I think oftentimes when we talk about human service partners, and I don't know why, I feel like it's unfair. The conversation really becomes around, robbing Peter to pay Paul. This agency is a little more than that agency, so why don't we move money from here to there? I frankly think all of our agencies are frankly underfunded. And I think that's due to 20 years of devolution of federal and state responsibilities to local government. But besides getting off on that tangent, I think that it's what we need to talk about here is, where do we want to make investments? What can we afford, which may not be everything we need? And then how do we support that? Knowing that we're not going to necessarily be able to accomplish everything we want, but how do we move forward in that regard? I think we have to raise boats here, not try to move things from one side of the scale to the other. That's really difficult. But I think with a strong plan and approach, and I think we're on that path. And I think using the federal funds to help support that work to get us to that space, we can really get there. But we need to be cautious and deliberative. I don't want us to, it's real easy to sort of say, well, why does this organization get more than this one? Or couldn't they just consolidate, which is the other conversation you hear a lot. And I frankly think, while some folks may say we have too many agencies, we have way too much need is what we really have. And if we focus more on how do we meet that need, and I think these folks are focused on that, and they've developed organizations that work really strongly to get there. I'm less worried about how many agencies we have in this town, and I'm more worried about how much need we have.
Sarah, I will always support a tangent that focuses on the devolution of funding from state and federal levels, because I think that's a really important thing for folks to understand why we have such pressure on local governments currently. I was really struck by how many agencies pointed out that they need more local funding to get matching dollars for state and federal funds. And I know it's a huge burden to track things like that, but I think it does make a compelling argument for us to be able to say, yes, for every local dollar we put in, we're seeing 2-3 more state and federal dollars coming into our community. And it would be great if the county could provide some support for how we can think about ways to track that for agencies throughout our community, because the more we can bring in state and federal dollars into our local community, that really widens our ability to provide support. ARPA, of course, gives us a great one-time shot to try to set up those systems. And I think it's on us to kind of really think strategically about how we set up those systems for the long term.
I was going to add, one of the new funders at the table too, is renewed funders, I would say, is with some of our agencies has been emergency service solutions grants, emergency solutions grants from Kansas, the state of Kansas, Housing Resources Corporation. You see agencies like the Lawrence Community Shelter absolutely being far more proactive in seeking those funds and being awarded those funds for their operations. But the Housing Stabilization Collaborative also received those funds. They also applied for AHAB dollars. And so I think that there is a lot more coordination of seeking all the funds. And we've definitely gotten a lot of support from folks like Danny Walters at the City of Lawrence. But, if I just point to Danny's position at the city of, yes, she manages some important federal programs, but she also coordinates a lot of the efforts related to making sure that those dollars are secured. And then they're expended in a way that is going to make sure those dollars keep coming to us. And the prevention piece of much of the work that we've been doing this last year and our partners have been doing this last year, they're paying attention. That agency is paying attention, and they want to see us do more. And they're challenging us to do more. And I think that's really encouraging.
This is Commissioner Reed here. I'm curious, and maybe you said it earlier, Sarah, and I missed it. Sorry if that's the case. With the ARPA potential that we keep talking around, I'm wondering, do we have a sense of timeline of when we are? I mean, I think I heard you say after budget, but do we have an idea of the amount of time we're going to have, I guess, before our 2022 budget is finalized, if there is any overlap, and like really starting to dig into the ARPA funds and begin making those choices? As I'm saying it out loud, I think there's not enough time, but can you give me a sense of a timeline for later this year anyhow on kind of what we're looking at down the road?
Yeah, I don't think there's going to be a lot of overlap. And so I think the approach to budget should be, what do we feel like we can sustain with local dollars, and where do those and how do we support those? And then turn our attention to an ARPA process that maybe that is informed by that process, but not necessarily completely constrained by it in terms of the ability to really make substantial change in terms of a variety of different initiatives in this community. And then come back and reconsider. Now, I know I'm asking you to do something that's very difficult, because I understand that you have a proposed budget in front of you with a tax increase. So that's the hard part, and why it's, I take this very seriously. We don't have all the answers right now, and at a certain point you have to set a budget. I can say all day long that a budget is the outside revenues associated with what is needed to make the operations happen, but ultimately it's a tax increase to people who have to pay it. So I understand some of that complexity. We could try, I think one of the approaches we've used in the past, if that just becomes to the point where, if for some reason there were funds that we were asking for that are included in your budget, or you could lower that mill levy and we take a flyer and try to figure out how we're going to make it work by a certain amount, and say, okay, 300,000 or 400,000's got to come in to offset some of these expenses. Just know that, as we move into future years, it's going to become a real challenge in terms of how we sustain that. I think that's why you don't see, there are not many funded supplementals in this area in this budget, because in the back of my mind, I was thinking that we can address a lot of this need through ARPA funds, at least on a temporary basis. And that's why I didn't recommend them to come into the mill levy, except for a few areas where I felt like it was really important that we try to make those investments. So I wish it was, we had all knowledge and we could make all these decisions all together, and we could be better off for it. But also like that, I last year at this time, we all felt very rushed by what was happening with the CARES Act. We had no time. We had less than 30 days to build a plan. And we funded over 95 agencies in this community and $25 million went out. But there was a lot of holding of our breath, and there were a lot of people who were very unhappy and critical about how that process was designed. So my hope is to try to do a little better this time and give us a little time to make that happen, and let the commission and the community really reflect on what our priorities need to be. With this second round of funds, with some of the immediate COVID, medical needs behind us, what should our priorities be? How do we made investments in education last time. Do we feel like we need to do them this time? We made investments in our business community last time. Do we feel like we need to do that this time? And so I think that those are some of those things I want the commission to have time to reflect on, hear from the community on, and decide how we want to go moving forward. Trying to combine that with a $200 million budget just felt like too much work. I think
That's valid. Thank you for humoring my out loud pondering anyhow.
I would say one thing we absolutely know from the use of the CARES funding is that housing and basic need, helping folks meet basic needs was one of the biggest things that we know folks needed, and we could always use more of. So I think as we move forward with the American Rescue Plan process, looking at things that we know the need was there for, and where we know some of our investments need to be made in the future. And there's a stakeholder group that's meeting already on housing and homelessness to develop a short and long-term framework around where those investments need to be made. The capital planning piece, which our friend Rebecca Buford has agreed to coordinate that group and focus those efforts on what we need in the future. And then the services that are associated with that to ensure that we're keeping folks housed and we're supporting them in those spaces. So we're already working to develop those short and long-term frameworks as it relates to where those investments can be made. But I think that there's a larger community that we need to think of as well, that some of these funds that you see in front of you and the requests need a little more coordination of efforts around on our part.
So I want to make sure we gave you all enough time to talk about ESC and housing stability. You said that a couple times, like we'd like to, do you feel like you've covered that?
Commission's had a work session on that topic a little better. If you have additional questions for us, I think I'm really proud of both groups that have continued to meet in this space, and knowing that, we all want to do better in this space, and how do we really build it? So I just mostly wanted, we had a request from tenants to homeowners and Family Promise. We had our normal ESC request, and then we had this position that would be added to the county structure for it. And I wanted to make sure you all had time to make sure why we had 3 different things going at the same time.
So I think I'm interested in hearing from anybody here who gets the ESC funds. And I know, well, as a service provider, that the way those funds have moved in the community has kind of changed a few times over the years in terms of disbursement. So since we're having this conversation and some of those partners are here, if anybody is willing that receives those ESC funds, to just, really speak to anything that you think is relevant for us to hear, whether that's just, we already know it's not enough funding, as pointed out by Sarah, and that's a larger issue, but curious about your thoughts on how those are dispersed currently versus how maybe they could be more efficiently utilized or managed or centralized. I'm just looking for any feedback, and I'm looking out and I see, Megan, are you the only one here from SRC? I don't see anybody from Willow.
We've got Ballard here and Willow's online.
Yep. Oops. Yeah. Jessica Beeson and Megan Stuckey are online. They can answer for Willow But I would also say, and we have Ballard Center, we have SRC, what I would also, and I think, yes, you should welcome them to talk about that, but I would also say we've been very intentional in the Emergency Services Council work group in the last year to welcome other partners in, because there was, whether it was real or perceived, there were feelings from other partners, and this is just my interpretation, that there was, while there was a spirit of collaboration in some of them, it was harder to access some of those funds in some of the other agencies. And that's, and for whatever reason, so the need to make sure we are opening up to other partners to come to the table and be a part of those conversations. And that's where Family Promise started showing up, and tenants to homeowners. It was a lot of it's just no wrongdoing on the part of any of the agencies that have been historically a part of the Emergency Services Council, because we asked that question as well, like, how did this council come together? But it was more, from a client's perspective, how do we streamline it? So that there is one place or a more streamlined way to go about accessing these funds. No wrongdoing on the part of any agency in particular. It's just the demand. Go for it. Yeah.
Please come up to the microphone if you're going to speak.
Can you guys hear me? So from an ESC perspective, I think, we've already established that the need far outweighs the amount of money. And that's why resource navigation, talented, skilled, dedicated resource navigation is so key. And that's why we do our family stabilization at Ballard. We have had to leverage all the resources in the community so that folks could focus on rent and utilities. HSC has been fantastic with rental assistance, but right now the focus is 30% AMI and below. I'm hoping we can open that up in the future, because that excludes a lot of households that aren't below 30% AMI. When it comes to the resource navigation, it takes so much time and so much effort from that staff member. They're literally absorbing trauma on a daily basis from the community. So the things that we've been working on at Ballard are trying to help people make sure that they can free up some of their own resources to invest in rent and utility assistance. We've taken 1,099 phone calls in 6 months for family crisis, including rent and utility assistance. And we've only been able to help 232 individuals, but only 113 of those were from ESC dollars. The rest come from other efforts by staff, community partners. We are constantly out in the community begging businesses to join our team in this family stabilization network to help families. We've gotten mechanics to donate $500 a month in vehicle repairs, which is huge. We have to use our family stabilization dollars to pay for tuition for children in our childcare so their parents can pay for rent and utilities because the money's not there. So we support a more coordinated effort with ESC dollars. But one thing I really want to hammer home is the amount of dedication and talented staff that is required to do that resource navigation. For so long, we've taken phone calls at the first of the month and then said, we're out of funds when we're out of funds. We're basically setting people up to play a game with their crisis. But at Ballard, we've stopped doing that. All those 1,099 people get routed to a staff member that tries to do resource navigation. And what we found over the past year is we can't sustain it. It's so much work. So when it comes to ESC, yes, the money never meets the need, but that's just half of the coin. The other half is making sure that people that are in crisis get treated like they're in crisis from a trauma-informed perspective and from trained staff that can take them on that journey. So that's what I've gotten. I hope that helps. Shannon, to go back to your question about equitable distribution amongst the different towns in Douglas County, what we've noticed is the city of Eudora and the city of Baldwin do their billing structures very different than West Star, Black Hills, city of Lawrence. So in our partnership with, say, Warm Hearts, where we're trying to help people with their heat bills, the city of Eudora and the city of Baldwin kind of put up some barriers for us. So those are some conversations I'd like to have with those cities. For example, Baldwin City doesn't reflect past due balances on their bills. It's really hard to work with an ESC agency that will only pay a past due balance if it's not reflected on the bill. Baldwin and Eudora do water, electric, all of that on the same bill. So trying to get a breakdown of those different things for an entity like Warm Hearts is very difficult. So the need is there in those cities, but we've had a couple situations where utilities have been turned off before we've been able to get the information. So when it comes to that equitable distribution of all towns in Douglas County, I would say that's our biggest barrier as an agency. So thank you for your time.
I know we're getting close to time, but in a recent conversation that we had for the, with the, I think it was Housing and Human Services branch, which is a branch of coming out of COVID that I do still coordinate, and we meet on a monthly basis because the needs are still there. That was the consensus of the group. But Megan, do you mind sharing kind of the increasing needs that you're seeing around in the aging population around housing insecurity? I think it's worth passing along for another perspective on one of our vulnerable populations.
Sure. I'm a lot shorter than Kyle. Just over the course of the past month or so, as the moratorium on the billing has changed and has been adjusted, what we've realized, and I'm not the only one, colleagues have shared this in conversations with some of our individuals we work with, they were under a false understanding that those bills would still be due eventually. And so we're getting just a significant increase, particularly from some of our seniors who truly, it seems as if they just didn't understand that those bills would continue to accumulate over that time. And they're coming in with between $1,000 and $3,000 past dues that they now need to figure out how to address and pay down. And typically in the past, the Senior Resource Center has been kind of fortunate in this group. We have a smaller chunk of the dollars, and we haven't always run out each month the way the others have with their allocated amount. And most of our seniors have worked out ways. They live on fixed incomes. They're pretty accustomed to figuring out how to work within their limited income. And so typically our requests had been $100 to $250. And all of a sudden it has not only spiked in volume of individuals, but in the amounts that they have to pay as well. And so we're moving through our dollars like we've never done before. The portion of our budget that the Senior Resource Center allocates out of our cash flow that we put toward this is also moving very quickly. And we're looking that it's only July. And so it's a little bit unprecedented for the Senior Resource Center specifically in the just this increase. And so I know that that's surely reflected with my colleagues as well, and in conversations that does seem to be so.
Megan, before you go.
I would pop in really quickly, if you don't mind, just to give a little perspective on the Willow's use of those dollars. We get $4,500 a year from ESC. Our total client services outlay is about $100,000 a year. What we give people to pay rent and utilities and all those kinds of one-off needs. Sometimes it's things like Kyle mentioned, car repairs and tires or whatever it is, but the bulk of it goes to rent and utilities. So for us, part of the staff's task is to figure out what pot of money. I mean, we have this big pot, but it's broken down into these little areas where this money comes from. Some of it's federal, some of it's really flexible donor dollars, some of it's ESC, some of it, so we kind of task our staff with saying, we'll find the best pot within our client services dollars for that particular client so that that client can utilize the best package, if you will, through us and through the other community agencies and dollars. So that's a really piece of this. If we're going to move to a more centralized location of those funds, is to think about how intricate and individualized those processes are for particular clients with particular sets of circumstances. Do you have children under 6? Are you a senior? Like where we can pull money for certain things really depends on the circumstances of the client. And that's one thing that a case manager from SRC or the Willow or Ballard will have an intricate knowledge of that client in a way that maybe a more generalized person in a central intake might not. So I just want to kind of keep that in the forefront of our minds.
Megan, you mentioned that what you've seen in because of the moratorium, you've seen a rise in this need. There was a need already, right? So if this is perfection, here's our need, and then we've seen this rise. Are you, and this is sort of a question to any, are you tracking the difference in this space from here to here? Because I think that's really important as we think about ARPA funds. What's that wave going to be? And yes, I think we can use ARPA funds to address that wave and maybe dip a little into that just general need. Are you thinking about that? Is that, as you think about, I mean, we've talked like, it'd be great if we can use ARPA funds for this, but I want to make sure, I'm really nervous that we're going to, at the end of 3 years, have millions of dollars worth of $29 million worth of requests that we're going to stay in. Do you feel like you're getting a good sense of those numbers? And I mean, that's maybe another partner wants to comment. You were just
For the Senior Resource Center, it's pretty simple, simply because, again, our allotment is a smaller amount of dollars. And so our numbers of individuals, and because we're a pretty tight group of individuals that we serve with 60 and over. And so it's pretty easy for us to track it because it's a volume that's pretty manageable in an Excel spreadsheet. And so, yeah, that would be a pretty simple thing for us to put together. Those with significantly more dollars and more complicated funding opportunities with, as Megan Stuckey was mentioning, the various opportunities that they can pull from. I think that would maybe be more complex for others, but probably doable. And part of the challenge with having a navigator, as we think about the various opportunities here that we can take advantage of, is the expeditedness of addressing some of those bills. And that's one of the additional challenges that we're facing right now, is that some of the conversations, even with the utility companies and with the landlords, are taking longer because they're having lots of these conversations with others as well. So when we think about the ARPA funds and this bubble that we may or may not be feeling right now, there's a bit of an optimism that I feel that, yeah, we may be able to get through this current status and then see some improvement from that on the other side. It's so hard. One thing we've learned over the course of the past year and a bit is that it's really hard to know exactly how things are going to play out here with the impact of COVID.
thanks.
If the commission doesn't have any other questions, we can move on to the county clerk. Do you want a quick break?
Because my power
Uh-oh.
doesn't seem to be working on that.
Okay, we'll just do a quick break to transition here to the clerk. Thank you.